Hello and welcome back to 90 Day Dental Day 37. So we're cracking through perio and we've got as far as the surgical treatment side of things. We did non-surgical yesterday and today we're tackling surgical. So with Hatem, take it away again.
Hi all, I'm here to talk to you as part of the 90 Days Dental. We're going to discuss just briefly an outline of surgical periodontics. It's a huge topic, but I've tried to summarize it in less than 10 minutes, so here we go. So in terms of just brief outline, we know that non-surgical treatment works very, very well, but sometimes we do need to pursue the surgical avenue. So I'm just going to outline just a few things we're going to discuss. Regenerative, lost tissue, crown lengthening, recession, some tissue loss, and then some periodontitis. So what is regeneration? We know generation, you've lost some gum tissue, you've lost some bones, cementum, you want to try and regenerate it. That's the ideal scenario. We don't want to be putting a filler, we want to regenerate what we've lost before, not just what looks good on the radiograph. So the ideal scenario is you want to regenerate all that tissue that you've lost, and that's the biggest argument. And we have been able to do this for quite some time. We're nearly at 15 years, and again, unfortunately, we need to try and sort of educate all our colleagues in terms of there is something out there. The lower left 7, you can see we've regenerated some hard and soft tissue there. We're using this material, Endogain, which is awesome material, helps regenerate the soft tissue that we've lost, which is cementum, periodontal ligaments, and bone. And we've got lots of cases over more than 15 years now, where we've got before and after effects. We've got infrabony defects, which tend to be a more aggressive form of gum condition. And we can see we've regenerated before and after nice bone fill. But most important thing is clinically, we're seeing reduction in pocket depth, and that's the key thing. So something called Endogain has been around. There is now a new form of flapless, which we're now trying out. But in terms of your localized advanced gum disease, infrabony defects, some furcation involvements, this is one of the best materials out there to use. And again, like I said, I've been using it for quite some time. It is amazing. It doesn't work in all cases, but you have to identify cases. But you can change teeth from being extremely guarded to now maintainable condition, because those infrabony defects are going to have difficulty for access for the patients and also for clinicians, dentists and hygienists. And again, this tooth on the canine with a poor prognosis, potentially it will increase in mobility, deterioration. If we get that bone fill, that's the ideal scenario. We're regenerating what we've lost, and that's one of the most important things that we can do, I think, in dentistry. Crown lengthening, one of the things that we tend to use, again, to try and save teeth. There's also, if you've got caries, if you've got tooth wear, you can't do dull equivalent, or from a cosmetic point of view. So we're doing a lot of these cases. This is just a cosmetic case, a significant amount of inflammation. Unfortunately, the crowns have invaded the biological width. We've done some crown lengthening procedure. We've put some temporaries in, my colleagues put some temporaries in. We leave the temporaries in this case, for 6 months. We've got a nice finish before and after. Not perfect, but a much better scenario of nice, pinker, healthier tissue and a good outcome for patients. So crown lengthening is one of our surgical techniques that we can use to change the cosmetics, but more importantly, to try and save teeth, especially if they're fractured or there's decay or equivalent subgingivally. Soft tissue grafting, again, it's one of the most important things that we can do, whether it's post-orthodontic, we've lost some tissue, before implants, after you do some kind of prosthesis, and also for gum shrinkage. So again, we can see one of these cases here where we've got, unfortunately, a significant amount of bone and soft tissue loss on the lateral incisors, hard tissue. Unfortunately, patient the alignment of those teeth is compromised, so implants aren't possible in this particular, unless the patient goes through further extensive orthodontic treatment, which we didn't want to do. We've now put in some soft tissue and some hard tissue to thicken that tissue up, so the patient can now have bridges or equivalent. But again, for her, the most important thing was to not feel the collapse of the tissue. It looks a lot nicer and it feels a lot nicer. So we're able to thicken tissues out quite nicely. And we can do that for bridge cases, like I mentioned before, implants are placed, before crowns and bridges are placed, before implant bridges are placed. Epithelial grafts, that's another form of modality that we can use. When we haven't got enough tissue, we can take some tissue from the roof of the mouth, and we can create a safety zone. Sometimes if you've got minimal amount of tissue, what we call keratinized tissue, the potential of that tissue to shrink further is significant. So we can take some tissue and transfer it. Yes, it doesn't look ideal in terms of color, but the purpose here is not cosmetics. The purpose here is to create that safety zone of new tissue. And we're doing that in a lot of cases where, unfortunately, if there's any kind of movement of those teeth or over brushing of those teeth, we can create that new zone of soft tissue for patients. Again, doesn't look great in terms of the color, but again, I'd rather have that and have the safety zone just in case there is further tissue loss, and that would most definitely compromise the patient. We come on to perimplantitis. Again, huge amount of disease out there, unfortunately. We can have one implant, that's fine, and the next implant you can see on the bottom right has significant amount of, and that's probably one of our biggest challenges. We haven't perfected yet, but we need to know and be aware. We have to raise the flap, we have to clean those threads, we have to shrink the gum tissue, but it's removing all that granulation tissue, and it's very challenging. But again, it's something that we need to do. Again, direct access, clean the tissue around that and remove it. That was just a brief overview of some of the things that are happening in surgical periodontics. By all means, please email me. Thank you for watching during these challenging times. And if I can be of further assistance, please don't hesitate to contact me. Have a good day.
Thank you for getting through this far with us through all the Perio Week side of things. And we've still got a couple more sessions to go. So back again tomorrow. In the meantime, please do like, share and follow us on YouTube and Instagram to keep getting the remaining videos in our series. See you again tomorrow.